Hey everybody, this is Eric Davis with Life Recovery Center, and I am going to be speaking with you today about signs of alcohol use and withdrawal symptoms. So let me start off by saying if you'd like to learn more about me or Life Recovery Center, you can visit us on the web at liferecoverycenter.net. I've also included contact information and so forth in this presentation at the end. So if I can ever be of service to you or answer a question, etc., please don't ever hesitate to reach out. So without further ado, let's get started. So I want to first start off by saying that it is imperative, very, very, very imperative that we always take alcohol withdrawal extremely seriously, because alcohol withdrawal can kill someone. So you hear stories about medical doctors, in the ER, a person's coming in, they have to have surgery and they're an alcoholic, and the medical doctor will literally prescribe one beer every so many hours, etc. So they do that to make sure the person doesn't go into withdrawal, and so on and so forth. Of all of the substances, there are really only two types of withdrawal that will kill a person typically, and that is benzodiazepines and alcohol. So with all the others, opiates, etc., on average, the person probably isn't going to die, but they sure are going to want to, because they're going to feel miserable. Okay, so physical signs of alcohol abuse. It's the main thing is smelling alcohol on somebody. We all know what alcohol smells like, and that's typically how we will catch someone, like if they show up to group. Unfortunately, that happens sometimes. A person will show up to group when they've been drinking, or I know we've all heard stories of people showing up to the MAD panel, intoxicated, and it's typically because the first sign is that someone will smell alcohol on them. But some of the other signs are loss or increase of appetite, personal grooming declines, if they're sick. A very big indicator is tremors or shaking of the hands or feet, etc. If they have the shakes, a regular person, a person who is not an alcoholic, who's not chemically dependent on alcohol, will not have tremors or shakes from not drinking alcohol. So if someone is having the shakes, that's a really good indicator that there's a much deeper problem. Some of the behavioral signs, I have students ask me a lot of times, they say, well, what are some, how do I know if I'm doing group and I'm working with clients, how do I know if somebody is getting ready to have a relapse? And I always tell them, if it's a client that you know well, and you start noticing that they, for lack of a better term, I hate to say it this way, but it's like if they start becoming a jerk, if they're just kind of becoming a jerk again, that's a really good indicator that they're headed for a relapse. Now, I won't bore you to tears, but the relapse warning signs are halts: hungry, angry, lonely, tired, serious. And so those are the relapse warning signs, where when a person is restless, irritable, and discontent, that tells me that they're, either getting ready to use or potentially are. So missed deadlines, person's not showing up like they're supposed to, drop in grades at school or performance at work, just not motivated, suspicious behavior, or chronic dishonesty. The CAGE questionnaire is an empirically based instrument that you can use to screen for alcohol abuse. So the first question is, have you ever felt like you should cut down on your drinking? All right. Have people annoyed you by criticizing your drinking? Have you ever felt bad or guilty about your drinking? And the final one, have you ever had a drink first thing in the morning to steady your nerves or get rid of a hangover? So the eye opener. Now, I'll share this with you. I'm a person in recovery myself, and my dad was an alcoholic. Now, I always think of Jeff Foxworthy, if you know who that comedian is. He said, if the only thing you inherited from your dad was alcoholism, you might be a redneck. So I guess I'm a redneck for sure then, because that's what I inherited from my dad. My dad passed away many years ago, but when I was a kid, I would always remember that on my dad's nightstand, by he and my mom's bed, there would be beer cans sitting there, and a lot of times, um, they like, it would just be an empty beer can sitting there. And I always thought, why is there always a beer can there? I never really I just didn't get it as a kid. Well, as I've gotten older and, had my own experiences with addiction and so forth, I now understand that that was his eye opener. He would have a can of beer sitting right there on the nightstand. So in the morning, when he woke up, he could open that can and, chug a beer so he could at least make it through the shower and kind of start his day without shaking all over the place and so forth. And my dad had a very, very serious problem. That's a whole nother story, but very bad problem with drinking. So if a person says yes to any one of these things, that's a good indicator that we should probably look and, assess the depth of the problem. Now, real quick on the difference between screening and assessment, because that's something that gets confused a lot. I want you to look around the room wherever you're at right now. Just look around, scan the entire room, and I want you to find some sort of an imperfection. Okay? Maybe it's a ding on the wall or a stain on the carpet, a scratch on the furniture. As soon as you find one of those, I want you to just stop and look at it. What we have just done is screen the room for imperfections. Now, if you were to get up out of your seat and walk up to that, mark on the wall or whatever it is, that's an assessment. So an assessment takes place after a screening has determined that something needs to be looked into further. Okay? So screening is something that is usually done very quickly. In mental health, we will ask questions about just random mental health things, or just screening for all sorts of problems and so forth. So that's the CAGE questionnaire. Cut down on drinking, annoyed you or criticized because of your drinking, ever felt guilty about your drinking, or have you ever had to have an eye opener? Now, the DSM-5 criteria for alcohol use disorder. So I want you to remember that basically in the DSM-4, okay, that was the addition of the DSM previously. We had two things. We had alcohol abuse or we had substance abuse, okay, or alcohol abuse, and then we had alcohol dependence. Well, what they did with the DSM-5 is they stretched all of that and made it into a spectrum. They did the same thing with autism, okay? So they did away with Asperger's, and there is now an autism spectrum. They have made addiction into a spectrum of mild, moderate, or severe. So in looking at these diagnostic criteria, the presence of 2 or 3 will result in mild, a diagnosis of alcohol use disorder mild. 4 or 5 makes a diagnosis of moderate, and 6 or more is a diagnosis of severe. Now, if a person has withdrawal, and we'll get into that in a minute, that's obviously a severe problem. Okay, but that's a whole nother diagnosis. So in looking at these criteria, the alcohol is often taken in larger amounts or over a longer period than was intended. So a lot of times when you're talking to somebody who has alcohol use disorder. It's, well, did you ever, go out and, yeah, I'm just going to have a couple of them with the couple of drinks with the guys. And before you knew it, you were on your second bottle of vodka and it's 4 a.m. and, it's just been off to the races. And a lot of times they say, yeah, there's a persistent desire or unsuccessful efforts to cut down or control alcohol use. A person who doesn't have a drinking problem doesn't typically feel the need to cut down, or to control it better. A great deal of time is spent in activities necessary to obtain alcohol, use alcohol, or recover from its effects. Craving or a strong desire or urge to use alcohol. Recurrent alcohol use resulting in a failure to fulfill major role obligations at work, school, or home. Continued alcohol use despite having persistent or recurrent social or interpersonal problems caused or exacerbated by the effects of alcohol. Okay, so that's one where, for example, my dad, he had cirrhosis of the liver. So his liver was swollen up to the size of a football. I mean, he had bad cirrhosis of the liver, and he continued to drink. Or we will see things, with addiction, we'll see where a person, I don't know, they're using meth and all their teeth fall out and they're still using meth. It's like they use in spite of physical consequences, or continued legal problems, etc. Okay? They do it anyway. Important social, occupational, or recreational activities are given up or reduced because of alcohol use. Recurrent alcohol use in situations in which it is physically hazardous. So that would be driving drunk, drinking and then operating heavy machinery, being drunk when we pick our kids up from school, something like that. Alcohol use is continued despite knowledge of having a persistent or recurrent physical or psychological problem that is likely to have been caused or exacerbated by alcohol. There again, tolerance as defined by either of the following. So 1, a need for markedly increased amounts of alcohol to achieve intoxication or the desired effect, or B, a markedly diminished effect with continued use of the same amount of alcohol. So what's kind of wild and what a lot of people don't know is when a person reaches a certain level of alcoholism, if you will, when the problem reaches a certain point, their tolerance actually goes down. And so where it will take someone even less, they can get drunk on even less than they did before. So that's a tolerance up or a tolerance down. Okay, that's can be either way. And then withdrawal, as manifested by either of the following. 1, the characteristic withdrawal syndrome for alcohol, or B, or 2, alcohol is taken to relieve or avoid withdrawal symptoms. Okay, so with alcohol, like if a person has to drink to not be shaky, like my dad did, that's withdrawal right there. Okay? So once again, 2 or 3 symptoms would be alcohol use disorder mild, moderate would be 4 or 5, and severe would be 6 or more of those 11 symptoms that we just covered. Now here's something that I included just to kind of give you an idea of ways that we can ask about each of these the symptoms, okay? So for the first one, had times when you ended up drinking more or longer than you intended, or have you more than once wanted to cut down or stop drinking or tried to but couldn't? So on and so forth without going through every one of them. But let's look down at 11. Found that when the effects of alcohol were wearing off, you had withdrawal symptoms such as trouble sleeping, shakiness, restlessness, nausea, etc., or sensed that things weren't right. Okay, so those are just some ways that we can, in the screening or in the assessment, ask about those symptoms without just going through a checkbox, of doing it that way. Now let's talk specifically about alcohol withdrawal. One of the first things is what's called mouse party. And mouse party, it's basically a thing put together by the University of Utah, but here's the link for it there. I'll include the link in the links page that I'm going to send with these presentations. But basically, it's it's a neat thing. You go to this website and you reach into a case with all these mice in there, and they're all affected by different substances. And it will walk you through how that substance affects the body. All right, so I highly recommend check out Mouse Party. It's I know it's nerdy, but it's pretty cool. So what causes withdrawal? In a nutshell, the reason that our body suffers from withdrawal is because alcohol has had an effect on our brain chemistry. Alcohol suppresses specific neurotransmitters in our brain. That's what causes the feeling of euphoria associated with being drunk. As someone continues to drink heavily over longer periods of time, the amount of alcohol needed to achieve the same effect increases. In turn, this makes our brain adjust to having massive amounts of alcohol being provided to it. Okay, so basically that becomes the normal. Okay, that when I'm pumping alcohol into my brain says, oh, I have to adapt to this situation because this is normal now. When you attempt to quit drinking, those same neurotransmitters are no longer suppressed and instead become overstimulated. This is what causes many of the withdrawal symptoms one might experience during the detoxification process. Okay, and we'll talk about detox here in a bit. What causes alcohol withdrawal? The longer a person has been drinking, the worse the symptoms get. This is because the brain has had longer to adjust to its suppressed state, making the absence of alcohol even more impactful. So you can only have alcohol withdrawal if two things are there. There have to be two ingredients. Those are alcohol dependence must exist, and then abstinence takes place. Okay? I will not have alcohol withdrawal unless I am chemically dependent. Now, abstinence could happen any number of ways. It could be voluntary. A person says, I'm over this, I'm stopping, I don't want to drink anymore. Okay? Maybe it's that. Or it could be a person gets sick or they get hurt and they're stuck in the hospital and they can't get out. They can't get out and go drink. So there has to be alcohol dependence. There has to be abstinence. So the DSM-5 criteria for alcohol withdrawal, these are 8 clinical features listed by the DSM-5 that may be present in alcohol withdrawal. For there to be a diagnosis of alcohol withdrawal, there should be at least 2 of these 8 present. Okay? So the first one is increased sweating, autonomic hyperactivity, tachycardia. The second is psychomotor agitation. The third is anxiety, increased hand tremor, insomnia, nausea or vomiting, generalized seizures, transient visual, tactile, or auditory hallucinations or illusions. Okay, now, my business partner, Tom, which some of you have probably met, he used to work in an inpatient facility, and he tells a story about a guy who, there's a couple of stories. So one is, there was this big bodybuilder that came into treatment, and Tom was working as a tech at the time. Okay, years ago, he's working the night shift. And I guess this guy comes to the desk where Tom's at. Sorry, I'm drinking some coffee while I'm doing this. Anyway, he comes to the desk where Tom is and he says, hey, I don't know who turned the TV in the ceiling above my bed on, but I need that turned off. I'm trying to sleep. And Tom's thinking, there's no TV in the ceiling. Why would there be a TV in the ceiling? So anyway, he walks down there, looks, and there's nothing. The guy was withdrawing from alcohol. He was in detox for alcohol. So he was hallucinating. And Tom, I guess, he says he stood up on the bed and pretended to turn a TV off, and all was right with the world. Okay, and the guy was like, all right, thanks, man. And I guess he went to sleep. Now, one of the other ones is Tom was doing an assessment on a guy, and he says that this guy he's like bobbing and weaving in the middle of Tom asking him questions. And Tom's like, you okay, man? And the guy said, who in the hell let all these birds in here? Okay, so he was visualizing, or he was having visual hallucinations that there were birds flying around, right? And that's a common thing that can take place with alcohol withdrawal. So that brings us to alcohol withdrawal with perceptual disturbances. All right, so that's a specifier there in diagnosis. That applies in the rare instance when hallucinations occur with intact reality testing, or auditory, visual, or tactile illusions occur in the absence of a delirium. Okay, so just for fun, there are 5 types of hallucinations. So there's visual hallucinations, where we see things. Olfactory hallucinations, where a person will smell things. Gustatory hallucinations, which would be tasting things that aren't there. Auditory hallucinations, which means hearing things. Or tactile hallucinations, such as feeling things. And tactile hallucinations are, that's very common with like meth use and things of that nature, where people think there are bugs crawling under their skin. Or they'll pick at their skin. That's typically tactile hallucinations. So what I've done here, keep in mind that alcohol withdrawal can be different depending on multiple different factors. But these are the most common stages, okay? So most of the time, this is what alcohol withdrawal would typically look like. So the first thing is 6 to 12 hours after the last drink, the person is going to experience agitation, anxiety, headaches, shaking or nausea, vomiting. 12 to 24 hours after the last drink, they may start to experience disorientation, hand tremors, seizures. And 2 days or more, they may experience seizures, insomnia, high blood pressure, hallucinations, fever. Keep in mind the type and severity of symptoms a person will experience depends on several factors, including how long they've been drinking, how much they consume on average when they're drinking, and if they abuse other substances, and if they have complicating medical conditions. Alcohol withdrawal and treatment. Okay, so first things first. This is what I teach the individuals in my office. We get calls a lot of times where a person will say, hey, I want to quit drinking, and, I quit drinking yesterday and I need help. The first thing that they ask, are you becoming ill when you stop drinking? If the answer is yes, we immediately refer them to a medical detox. Because like I said before, withdrawal from alcohol can be fatal. It can absolutely kill someone. So it's extremely important that they are detoxified under the medical supervision of a physician and medical team. Tom has known people that have died. There's a friend he had in high school, I guess, and he said that this guy, his parents were going out of town, and this guy decided, you know what, I'm getting on the wagon. I'm going to stop drinking. I'll just stay home and tough it out for a few days. when his parents came home, the guy was dead. Had he been medically detoxed, he would probably still be alive, because they would have monitored his blood pressure, heart rate, all of those different things. So medical detoxification, or what we typically call detox. So it's the process of breaking an individual from the physical bonds of addiction. The side effects or withdrawal symptoms that occur during detox can be dramatic and influential. Things like cramps, aches, sleeplessness, even hallucinations. The amount of time that detox will last depends on the substance being used. With alcohol, if I'm correct, I think typically in inpatient, and don't quote me on this, I am not a physician, but if I recall correctly, most people who were detoxing for alcohol were typically in the detox level of care for like 4 to 5 days, seems like. Sometimes maybe 6, okay? And in some detoxes, it can be even a few weeks. The overall goal of the detox process is to minimize the symptoms of withdrawal and keep the individual as comfortable as possible while coming off of the substance. So the way I explain it to classes that I teach is I say, think of we are on a plane, and that plane is crashing. It is heading toward the ground. We are falling from the sky. Detox is kind of like the physician, through medication, flies up, and like basically we land on that other plane's back, and that plane slowly inches us down to the ground, and it's still going to be a bumpy landing, but it's not going to be nearly as bad as it had been if we had just ran straight into the ground. And that's kind of what they do. It really is about keeping a person comfortable. We're going to talk about medication-assisted treatment. There are some medications that they do use for alcohol withdrawal, but it's really just to minimize and to keep the person safe. That's another important part to note there. There's also what we call PAWS, P-A-W-S, post-acute withdrawal syndrome. Now, PAWS is kind of like a protracted withdrawal that kind of can happen, even weeks or even months, even after a person has come off of a substance. And for especially heavy drinkers, certain symptoms can persist even after the initial withdrawal period is over. Many of these symptoms are milder, but their persistence can make post-rehab life difficult for some people. So here are some of the common symptoms of PAWS, accident proneness, dizziness. One of the best ways I've ever heard it described is I had a client who was experiencing a bunch of this stuff, and I asked him, I said, just, how do you feel? Because he was having a really hard time kind of expressing how he felt. And he looked at my wall and he said, "You see that picture hanging there?" And I said, "Yeah." And he goes, "I feel like I'm like, let's say I'm a picture on the wall, and I'm okay, I'm all in one piece and everything, but I'm just kind of hanging crooked." And that was kind of how he explained. He felt off. He didn't feel bad necessarily, but he felt off. And that's kind of what we'll see. Trouble sleeping, etc. So that's a normal thing. When somebody's been a heavy user, it's normal for them to experience lots of different things for quite some time. So the treatment for alcohol use disorder. Obviously, first there's detoxification, okay? And then in therapy, we use what's called cognitive behavioral therapy. We use that because we are addressing the thinking and behavior that goes with addiction. It's very important to understand that addiction and chemical dependency are two separate things. two entirely separate things. They typically go hand in hand, but a person can be chemically dependent and not have the illness called addiction. Now, what I mean by that is my grandma, she just passed away last month, unfortunately, but my grandma was really old and she has been in pain for years. And I think she was on hydrocodone for pain, okay, had been taking it forever. Now, if I had just taken her medicine away from her, do you think she would withdraw? Absolutely. She absolutely would have withdrawn. However, I can tell you just from talking to her, she's not an addict like me. She's not a person with substance use disorder, okay? She was chemically dependent on those, I'm guessing, but she does not have the thinking and the behaviors that I have that went along with chemical dependency for me. So the reason that cognitive behavioral therapy is really important is because if we don't address the thinking and behaviors that go along with addiction, nothing's going to change. And that's why we see people replacing one drug with another, or it's just the revolving door, if you will, of coming into treatment. Okay, so that's why cognitive behavioral therapy is vitally important. Now, with medication-assisted treatment, going back to that, medication-assisted treatment only treats the chemical dependency. Okay, so if someone starts taking Campril, or Antabuse or naltrexone, that is only treating the chemical dependency. It is not treating the thinking and the behavior. We see the same thing with opiates and Suboxone or Vivitrol. That is only masking withdrawal symptoms. If the only thing a person is doing is taking medication, they are not addressing the true root of the problem. Because if we don't address that stuff, they're going to be right back to square one eventually. So always remember, medication maintenance needs to be accompanied by treatment, okay? It's called medication-assisted treatment. That means treatment is being assisted by medication, not the, medication being assisted by the treatment. The treatment should be at the forefront and the focus, while the medication treats the withdrawal, okay? Or treats the chemical dependency. I'll get off my high horse, sorry for that. But it's really important, medication-assisted treatment is not a bad thing. However, it does become a bad thing when the only thing that we are changing is the person's taking medicine instead of using, and nothing else has changed, because we are setting them up for failure in the long term. Antabuse, okay? Antabuse, or I always say this wrong, disulfiram ethanol reaction, DER. Okay, antabuse is something that a lot of times physicians will give to somebody to where if they do drink on it, they will get sick. And that DER is due to increased serum acid, I always say this stuff wrong, acetaldehyde concentrations generated by the metabolism of ethanol by alcohol dehydrogenase in the liver. So basically, this pill will, if somebody drinks on it, they get sick. I had a client years ago, and I remember asking him, he drank on it. And I said, oh man, what was it like, Steve? Then he said, well, I didn't die, but sure wanted to. And think about the nature of that problem. Really think of the depth of that thinking and behavior. He wanted to drink so badly, he was willing to drink on the antabuse. So I'm not saying antabuse is bad, because it's not. It's a diversionary thing, but it's not a cure. That's the thing. It's not going to fix the problem. So in summary, remember, if a person is getting sick when they stop using, they need to go to the hospital. They need to go to detox. Okay? Because alcohol withdrawal can be fatal. If you smell alcohol, it's probably because somebody's drinking. So anyhow, that's me, Eric Davis. If you have questions about this presentation or questions about anything in general that I can be helpful to you with, please don't hesitate to reach out to me. There's my contact information. And once again, I'm from Life Recovery Center, and thank you for having me. I appreciate you.